Hey folks, it's Patriot Nurse, and in today's segment I'm going to discuss with you Obamacare, the changes it will bring, and what you can do to prepare yourself. First off, in stating the obvious, I'm a nurse, but my opinion does not necessarily have to coincide and underscore the opinion of certain agencies that exist to represent nurses. I would imagine it's the same with physicians. But the disclaimer that I'm trying to make to you is this: just because I'm a nurse and just because another person who has a differing opinion says that they're a nurse too, our nurseliness does not make us have to agree to a cohesive social welfare program functionally. I'm not a bad nurse because I don't agree with it. I'm not a bad human being because I don't agree with it. And I'm sure that you probably would view the same thing. So let's discuss what's going to happen with Obamacare. The easiest picture that I can paint for you is one that you perhaps have already experienced. Your local health department. If you have spent any time at your local health department, I'm sure you will note that usually when you go there, the health department, although the staff are usually very kind, the health department is usually understaffed. There are tons of people there. They are waiting and waiting and waiting if they can get an appointment. And the resources are finite and limited. Usually it's not a particularly happy place to be. I don't particularly enjoy going to the health department for any reason. Now, the health department is the readily available subsidized health care for the masses. The health department is also a little vignette into what things will look like on a national level. Instead of keeping our current system, flawed though it is, I think it's fair to say that healthcare costs are exorbitant. There is no reason that getting a lab panel drawn has to cost $750. I'll be the first to admit that. But the issue in that is not necessarily that it's the federal government's job to fix it. It's just that prices have gone crazy because of insurance companies. Didn't used to be that way when doctors were paid directly. But when insurance got involved, things started getting really hairy really fast. So in appraising the situation for what it is, we need to recognize that in the future, I can't tell you exactly when, in the future, our healthcare system will look a lot like England. I have viewers in England, and I'm not dissing you, but I don't want my healthcare system looking like that. With the system that we are going to be encountering in the United States, the cutting edge treatments, the plethora of options that we have now to be able to deal with different diseases that arise, they're just not going to be there. The financial incentive is not going to be there. So we need to be realistic about this. We also need to be realistic about the quality of care that we're going to face under Obamacare. Our nursing care ratios right now, certainly in the hospitals that I have worked at, they were okay on a fully staffed great day. They were abysmal when one, possibly two people called in sick. And that's with the amount of I guess you could say, elective procedures, like knee replacements, hip replacements, things like that. That's on a good day. What's going to happen is that you're going to find that as more people have entry and access into the healthcare system with a finite amount of resources, more and more people drawing on this finite resource, meaning care, it's going to draw and tax our healthcare providers. Many of the physicians that I know of had talked about, at least when I had dialogued with them, they said, well, I had thought about staying on a few years after retirement, but I'm not going to do it now. What's the incentive? You're also going to find that the number of specialists being churned out of our colleges is going to drop. There's no incentive for that. You're also going to find that the number of nurse practitioners giving care, the functioning as the primary care provider, is going to go up. I love nurse practitioners. I don't have a problem with that. The issue is that because you're having fewer and fewer physicians, you're having more and more nurse practitioners. The nurse practitioners are already incredibly underpaid for what they do in my area. And what you're looking at is increasing their patient load on an already taxed base, emotionally and mentally, so you're going to be dealing with a more fatigued healthcare provider. All of this to say that the Obamacare America of the future is going to be a healthcare system that you want to avoid if you can. The way to do this is to focus more on our preventative health. meaning eating well, increasing the amount of raw fruits and vegetables that you are eating in your diet, cutting back on refined starches and sugars. The list goes on and on. But one thing that we can universally take away from this and apply to help save ourselves and our family in the future, I don't want to have to venture into that healthcare system if I can help it. I want to be able to take care of myself and my family at home if at all possible. I also want to make sure that I am trying to nip in the bud the diseases of civilization: diabetes, high blood pressure, smoking related diseases like emphysema and COPD, cancer. If I can avoid these diseases that would cause me to be hospitalized, number one, I'm going to have a healthier and happier life anyway. But two, I'm not going to have to partake of a healthcare system that is, although available, substandard, especially when you compare it to what we used to have. I hope that was helpful for you guys today. I wanted to be realistic about the issue and also be realistic about the solutions. If it's passed and it's not going to be getting repealed anytime soon, probably ever, then we have to look it square in the face and fight the monster. The easiest way to do that is to take care of yourself now, invest in your own health and the preventative aspect of things, also minimize stress. I know that's challenging in this day and age, but try and do it. We also need to be vigilant for taking care of our families and for nipping things in the bud ahead of time. This is one of the things that I hit really heavy on in my classes, in the Medical Prep 101 classes that I teach. Hitting things early will help you, number one, not have to spend as much time and energy and resources taking care of a disease or an issue when it manifests, because you've knocked it out early and it doesn't progress into something monstrous. But also it's going to help keep other people from getting sick in your family. So keeping this in mind for the future is going to benefit everybody. It's going to benefit you no matter if it's a disaster scenario or we just end up having a slower descent into a Stalinist form of government like we're sort of currently experiencing right now. But I hope it was helpful for you guys. The upcoming Patriot Nurse Medical Prep 101 classes are January 20th in Philadelphia, so Sunday, January 20th, February 10th in Sellersburg, Indiana, February 24th is Fort Lauderdale, March is the Texas classes, April is Yakima, Washington, and then May is in Indianapolis. So all the classes, course registration info is available at the website, www.thepatriotnurse.com. Hope it was helpful for y'all. And for now, it's Patriot Nurse signing off, and I'll see y'all later.